Recording going. All right, we are streaming. We are recording.
Okay, thank you. So, welcome everybody. I'm going to start out with one housekeeping note, which is that Kimberly, I'm hoping that you can share the PowerPoint presentation with Nellie because I don't have access to internet.
I can do that. Give me just a second.
Okay. Great. All right. So welcome everybody to our medical program Q&A session. We are, as is probably evident, we're unable to see anybody here today, so it's a little bit awkward, but we're gonna plow ahead anyway. So we hold these events regularly, and they provide an opportunity for us to explain policy changes to our programs, and to give the public an opportunity to ask questions and have staff available to provide some answers. So these sessions are recorded and are posted to our YouTube channel. So anybody who's not able to attend the live session can watch it later on. And we also send out the link early and let people know that they can provide questions to us ahead of time. For today's session, we did not receive any questions ahead of time, so we are looking forward to hearing from folks at the end of in the later part of this session. So since today we're discussing the medical program, I have with me, I'm Bryn Hare, I'm the Executive Director of the Cannabis Control Board, and I'm very pleased to introduce Priya Holland, who is our new medical program technician who just joined us last week. And welcome her to the CCB. And this gives everybody an opportunity to see her and put a face to a name when you're reaching out and you reach Priya. We also have Melissa Anderson with us, who is a Cannabis Control Board licensing agent who works extensively with the medical program. And we also have Kimberly Lashua, who is the Director of Licensing for the CCB. So thank you all for being here today. Those are our introductions. What we're going to start today with doing is that I'm going to go through a PowerPoint presentation that details the changes that the House Bill H270 proposes for the medical program. So I'll start with going through those changes, and then we'll turn it over to Melissa, and she will talk about sort of the practicalities of what those changes mean for the program. And then after that, we will move on to the question and answer session. So our focus today is really going to be on the changes to the medical program that are imposed by H270, which is the bill. And the board is going to be working over the summer and fall with a stakeholder group to make substantial changes to the medical program. And so that is going to be the opportunity to engage with the board on what structural improvements the program needs and any recommendations for those improvements. So I just want to emphasize that it's really our focus today to make sure that people, medical patients and caregivers, understand the changes that the bill is imposing and how to navigate those changes. So I'm going to go ahead and start with the PowerPoint presentation. Nellie, if you're able to share that for me.
Give me 1 second. I'll get that going. I'll let you know when I have it up.
Sounds good. So while you're doing that, I'll just start by saying that the bill here makes some pretty significant changes to the requirements for patients and caregivers. And I want to point out that the bill has not yet been signed by the governor. So even though this is not yet law, as soon as it is signed by the governor, these changes are going to go into effect because all of the medical program changes take effect on passage. So these changes could go into effect as soon as this week, depending on when the governor, if and when the governor signs it. So even though the bill hasn't been signed yet, so it's not law yet, we wanted to get this information out as soon as possible so the medical cannabis community can be prepared for these changes. Many of the changes that the bill imposes reduce the costs and administrative burden on patients and caregivers. So hopefully this session is going to prevent people from wasting any time or money unnecessarily on background checks and fees and visits to healthcare providers, etc. So we can go to the first slide, Nellie, when you're ready. So the first change that H270 imposes is that it eliminates the requirement that patients who have been diagnosed with PTSD be undergoing counseling in order to qualify for the program. So under current law, medical patients who have PTSD, they are required to be actively undergoing psychotherapy in order to qualify for the program. So that's a requirement that's unique to the PTSD diagnosis, only applicable to patients with PTSD. And it's in addition to the requirement that that patient provide verifying information from their healthcare provider that they have been diagnosed with PTSD. So it's sort of two distinct requirements. They have to be engaged in counseling and they have to provide that healthcare verification, just like all other qualifying conditions. So what the bill does is it eliminates that requirement that a patient be engaged in psychotherapy as a condition for qualifying for the program. So therefore, if you are a medical patient who has been diagnosed with PTSD, you will qualify for the program, even if you are not currently engaged in psychotherapy. So the note there is just that even though that requirement that you be engaged in psychotherapy no longer applies, you would still need to obtain verification from your healthcare provider that you have a PTSD diagnosis. So that's the first change. We can pop to the next slide, Nellie.
Okay.
So the next change that the bill would impose is to increase the plant count allowance for patients and caregivers. So under current law, there is an allowance of a maximum of 2 mature and 7 immature plants that patients and their caregivers are allowed to cultivate. So the bill increases that plant allowance to 6 mature and 12 immature plants per patient. So if a caregiver is growing plants for a patient, they can grow up to 6 mature and 12 immature. And as you'll see later on, the number of patients that a caregiver can provide services for has increased to 2. So that would be 12 if a caregiver has 2 patients, that would be 12 mature and 24 immature for those 2 patients. So this increase is really going to help ensure the patients have access to enough cannabis over the course of the year, and also allows patients and caregivers who are cultivating to grow a different variety or a wider variety of cultivars. And that's really designed to help patients be able to have a sufficient number of different strains to help them alleviate their symptoms, since different cultivars can help alleviate different types of symptoms. Okay, we can move to the next slide. So the next change that the bill imposes is it changes the background check requirements for caregivers. So currently, what is required right now is that anybody who wants to be a registered caregiver has to undergo a fingerprint-supported FBI criminal history record check in order to be registered as a caregiver. So the bill eliminates that requirement, and instead it requires background checks that the CCB staff can conduct ourselves in-house without requiring any sort of administrative work on the part of the potential caregiver or charging any additional fees. So that change is really going to reduce some of the costs and the hardship associated with becoming a registered caregiver. So that FBI fingerprint supported FBI background check is eliminated, and instead CCB staff are going to be conducting a Vermont criminal history record check, and also a check of the Vermont Child Protection Registry, and also the Vulnerable Adult Abuse, Neglect, and Exploitation Registry. So those are the internal checks that the board staff will conduct before they issue a caregiver card. All right, we can move to the next slide. So the next change that the bill imposes is to, as I mentioned a little bit earlier, increase the caregiver to patient ratio. So current law requires that a single caregiver can only serve 1 patient at a time. The exception to that is if the patient is under 18, and then up to 2 caregivers can serve a minor patient. So the bill changes that limit in 2 ways. It first allows a single caregiver to serve up to 2 patients at a time. So again, that has an impact on the number of plants that a caregiver could potentially be allowed to cultivate. And it also allows the board to, on a case-by-case basis, allow additional caregivers for a minor patient. So if a patient is under 18 years old, current law limits the number of caregivers for that patient to 2. And what the bill does is it says the board can appoint additional caregivers for a minor patient on a case-by-case basis. Okay, we can move to the next slide. The next change is to change the renewal period for most qualifying conditions. So under current law, there's a requirement that patients with any qualifying condition have to renew their card, their medical card every year. And the bill changes this in sort of a way that's a little bit confusing, but I'm gonna go through it, and Melissa's gonna go through it too. So hopefully we'll make it clear enough. So the expiration date for the medical card is now 3 years for most qualifying conditions. So patients that have the qualifying condition of a disease or medical condition or its treatment that's chronic, debilitating, and produces the symptom of chronic pain, but no other symptom that's listed in the statute, those folks are still going to be required to renew their medical card annually. So if you qualify under that chronic, debilitating disease or medical condition, and the symptom that medical condition produces is chronic pain and chronic pain only among the list of eligible symptoms in the statute, then you are still required to do an annual renewal for your medical card. But for example, if you have a disease or medical condition and one of the symptoms is chronic pain and another symptom that you have is seizures, then you will only be required to renew every 3 years. So it's only if that symptom is limited to chronic pain that you are required to still renew your medical card annually. So I hope that was clear. Melissa, I'm sure, is going to clear it up for me when she goes through her part later. Okay, you can go on to the next slide, and I just have 2 more slides here. So the second to last change that the bill imposes is really kind of a technical change to the statute, which is going to have a pretty big impact down the road. Under current law, there's this provision in statute that the Cannabis Control Board, is not allowed to create any rule for the medical program that is more restrictive than the former rule that was in place beginning in 2015. So as many patients that are probably on this call know, the medical program was formerly housed within the Department of Public Safety, and the Department of Public Safety ran the program, and the rule was promulgated by the Department of Public Safety. So the board has been really hamstrung in its ability to create requirements for the medical program, given this specific section of law. So the bill repeals that provision of law that no rule can be more restrictive than the former rule. And that's going to allow the board to, for example, require independent third-party testing of medical cannabis products, and also require like minimum training standards, for example, for employees of the medical dispensaries. So that change, even though it seems pretty technical, is going to allow the board to really improve the consumer safety provisions and the consumer protection provisions in the medical program. And then lastly, we can move to the last slide, Nellie. The bill establishes sort of a study committee for the medical program. And that study committee is the Cannabis Control Board and a number of stakeholder groups, including the Vermont Academic Detailing Program, registry patients and caregivers, licensed medical cannabis dispensaries, and medical professional stakeholders. That group of folks is tasked with making recommendations to the legislature about the program, and specifically the conditions that should qualify for medical cannabis, the strains that are appropriate for a given condition, dosing and treatment standards, and any other recommendations that could improve the program. So this group of folks is going to meet over the summer and fall 4 times. And those meetings are going to be open to the public. So the board is going to notify the public of when these meetings are happening. There will be a remote link for people to join remotely, and there will be a public comment session. So that, as I was mentioning at the outset, that is really a good time for the public to engage with the board and the stakeholders in making recommendations about sort of the structural improvements or other legislative improvements that the program needs. So the board is going to report to the legislature in January with sort of the outcome of this study committee, any recommendations that the committee develops, or any conclusions that have been reached by the study committee. So that concludes the changes imposed by H270 to the medical program. So at this point, I will turn it over to Melissa to make some comments.
Hello. This up here. I'm just gonna kind of go through all of the stuff we just went through on more about what that means for everybody as a patient or a caregiver in the program. So the change of post-traumatic stress disorder no longer requiring undergoing psychotherapy to complete the renewal. This means that we no longer need the page of the application where we ask for you to provide your mental health care provider's name in order to verify that you are undergoing psychotherapy. The regular healthcare professional verification form that your physician fills out is sufficient. We will be updating our paper forms to reflect these changes, but the online application will take a little longer to update. That won't matter as much to on the patient side of things, because if your physician is filling the form out online, that part would be separate anyway. So let's see. So plant count limits changing from 6 mature and 12 to, changing to 6 mature and 12 immature plants. What does this mean? So each patient or their caregiver, not both, may possess up to 6 flowering plants and up to 12 plants in a vegetative state. We no longer require you to report whether you are growing or not. Again, this is no longer on our paper forms, but the online forms will take some time to reflect these changes. If you are completing your form online, it is a required field, so it will make you choose an answer. You can just choose no, regardless of if you're growing your own or not. Let's see. Okay, so the board will no longer conduct background checks for caregivers. What does this mean for you as a caregiver? If you have already initiated the process that has been happening for the last year, as far as the fingerprint supported background checks go, staff will promptly be shredding that information. And if you've already started the process and we haven't received those results yet, when we do, they will be shredded also. If you haven't started the process yet, but expected that you were going to need to, you will not. So the forms that we send with the caregiver cards will no longer be sent. Don't have to worry about it. Okay, so renewals for patients with any condition other than chronic pain will only need to renew every 3 years. Meaning, if you renew in 2023, and for example, you have MS, your new expiration date will not be until 2026. So you won't have to worry about renewal at all for 3 years. So if you have a qualifying medical condition of acquired immune deficiency syndrome, glaucoma, cancer, human immunodeficiency virus, Crohn's disease, multiple sclerosis, Parkinson's disease, post-traumatic stress disorder, or any other disease or medical condition or its treatment that results in an intractable symptom of cachexia or wasting syndrome, severe nausea or seizures, you will only be required to renew every 3 years. So if you fall into that category, every 3 years. An updated healthcare professional verification form completed by your physician will be required at each renewal, since it's every 3 years. If you have a qualifying medical condition or its treatment that results in an intractable symptom of chronic pain only, you will still need to renew annually. However, you will only need an updated healthcare professional verification form completed by your physician every other year. So you'll still need to do the renewal, but the healthcare form piece of it will only be required every other year. It's a little confusing, so please feel free to reach out to us if you are not sure what you need. And we will look into it and get you an answer. Okay. So the board being allowed to create new rules to ensure both the medical and adult use programs have similar requirements for safety and education. This means that over the next several months, the board will hold a series of public meetings to discuss these proposed changes. A single caregiver may now serve up to 2 patients at a time. And in addition, a minor patient may be appointed more than 2 caregivers on a case-by-case basis. So what this means for patients and caregivers completing the forms is that you may now also include a second caregiver as part of your application submission. Each caregiver is required to complete their own application and each pay the $50 application fee. If you're completing a paper application, you will just include 2 separate caregiver applications. If you're completing your application online, you can submit your patient application online. One of your caregivers can submit their caregiver application online. The second caregiver will need to submit their application via paper at this point in time. We will be working on updates to our portal to allow for both. It's just not ready yet. And lastly, the board creating stakeholder group for recommendations, expanding the list of qualifying conditions, identifying strains, etc. If you would like to submit your recommendations for this group to consider, you can send an email to ccb.med@vermont.gov with the subject line stakeholder recommendations, and we will collect these comments for the stakeholder group. You may also submit names for individuals who would like to volunteer to be on the stakeholder group. Same address, same email address, same subject line, and we will collect all those and pass them off to the appropriate parties. And that is all.
All right. Thank you so much, Melissa. So at this point, we are going to turn it over to our participants for any questions. As I mentioned earlier, we didn't get any questions in advance of this meeting, so we're just going to open it up to people. And Nellie, I'll turn it over to you to call on folks for us.
All right, we have Jessie Lynn up first.
Great. Go ahead, Jessie.
Hi, thanks so much for taking public comment. My name is Jessie Lynn Dolan. For the record, I'm a registered nurse. I started the Vermont Cannabis Nurses Association back in 2017. I'm also the president of the American Nurses Association Vermont, and I still work full-time as a nurse with one of our most vulnerable populations here in the state. A couple of things I want to mention, please, is if we could look at offering more meeting times than just a daytime. This is a really tough time for people who have a job to be able to attend these meetings. And Bryn had mentioned that you guys meet regularly for the medical program meetings. I would love to know how often, so that and have a better understanding. The Marijuana for Symptom Relief Oversight Committee used to meet regularly and hasn't met in about 2 years at this point. It was the only thing we had doing any advocacy or meeting for patients. So I'd also like to have an understanding as to where that group is at and if that will be happening again. You guys mentioned a stakeholder group. I think it'd be great for the community to understand which medical professionals will be involved, because I think we know the Vermont Medical Society's stance and really need to see some medical professionals that have a better understanding, not only of the endocannabinoid system and cannabis as medicine, but are more evidence-based than fear-based. the Marijuana for Symptom Relief Oversight Committee also had a seat appointed to them to be on the advisory committee. That seat has not been utilized or filled for over a year at this point, again, meaning patients haven't had their voice. I'd also like to ask if you guys at some point could give us an understanding as to where the funds for the medical program have been allotted to and how they're specifically being used for the medical program, hopefully not for the adult use program. The other couple things I wanted to mention is right now with the medical program and some of them having adult use licensing, we are seeing the medical dispensaries no longer making patient-specific medication like patches that work for epileptic children, and they have decided not to make that, to focus more on adult use profitability. So where does that lie, and what mandates do the medical dispensaries have to actually continue to support their patients? I'm thrilled to hear that they will be mandated to third-party lab testing, but I would hope you guys can absolutely consider mandating terpene testing regardless of the expense. We need to know what terpenes are in medicine to help people utilize the medicine at their not only minimum effective dose, but medicine. As far as education, I would love to also see you guys, give us an explanation and an understanding as to what that education looks like, because we know a lot of the education people are taking right now are 2-hour online classes from out-of-state vendors who don't understand the cannabis community here in Vermont, let alone the struggles the medical program had went through, let alone is enough education and information to actually help our vulnerable patients. Another thing I would ask is that you guys look at, and this is something I've spoke to Kimberly about for over a year at this point, is having some follow-up so patients actually get in, are reached out to and are supported to not have their medical cards expire. And if they do expire, do they have legal protection for what they're already growing or what they already have in their home? And it's not to their fault if the Cannabis Control Board is not doing the follow-up to help support patients, make sure their cards do not expire. I would also ask you to consider and keep asking legislators for the money to do so, because we've asked them for funding for adult use program positions. We need a medical professional on and involved in the medical program. As far as H-270 goes, we know that one person can now be a caregiver for 2 people at a time, but what we need is patients to be allowed to have more than one caregiver that are not under 18 years old. With the baby boom era happening, and with if a caregiver's plants die or something happens, that patient has no one else to reach out to. They should be allowed to have multiple caregivers. As far as renewal for chronic pain, I would ask you to consider legislatively in the future looking to change that as well. We really need to look at chronic pain separately. Acute surgery that someone could get better with PT in a year or two is very different from a genetic has chronic pain from that will never go away. So I think that's a little discriminatory when we think of somebody with chronic pain with a genetic disorder that's not on the list, and they still continue to have to annually renew that medical card. As far as the plant count in H-270, I think that's a fabulous start, but I would also ask you guys to go further with unlimited veg count. The veg plants really do matter just as much as the flowering. And the one thing that I believe is legislation from last year is that there's no longer a 3-month relationship mandated to have that provider offer the medical card to patients. Patients don't know this. This is information that we need to have on the website. We need a bullet list. We need social media information so patients have some of this information. Besides this meeting, how are patients going to know that they can now grow 6 plants instead of 2? So I'd love to see a little more community outreach and education for patients. For the future, I'd like you guys to look at, please, looking into having licensing for research. We need research. We also need on-site consumption. We need laws to protect patients so they actually can consume. If they're renting and they don't own a property, they're not able to consume, and that's not fair. So we do need to look at on-site consumption for patients. I'd also ask you guys to continue to look at worker protection against DUIs for patients, as well as in the future, we absolutely need patients to be able to afford this medicine. So insurance coverage or workers' comp coverage, New Jersey is doing that right now. And lastly, I'd ask, and this is patients have been asking this, adult use retailers have been asking this over and over, to allow patients to shop at adult use retails without paying the taxes and without the adult use retailer having to absorb those taxes so that they can support patients. Adult use also should be able to donate to patients and do their part. We know patients want to shop locally and not report to Burlington once a week. They want to have craft cannabis from small local Vermonters instead of out-of-state conglomerates. So I know a lot of information. If you'd like, I could definitely send that you all, in an email, but I do think this is a great start to some of the changes, but I would love to see what some of us call one of the most restrictive medical programs in the country definitely do a little bit more to support our patients. So thank you for what you're doing and where the changes we have had, but let's work together to see a lot more changes in the future. Thank you.
So thank you, Jessie Lynn. That was, I am taking that as a comment as opposed to a question, but I do want to point out that the bill in its description of the study committee that will be meeting over the summer and fall to recommend additional structural changes to the medical program. The stakeholders include the Vermont Academic Detailing Program, which is a program out of UVM, registry patients and caregivers, licensed medical cannabis dispensaries, and medical professional stakeholders. So this list, I think is pretty broad and inclusive, and I see a place for you in the stakeholder group, Jessie Lynn, to share all of your thoughts with that group that will be directly tasked with coming back to the legislature with recommendations. And as Melissa mentioned, it would be great if you shared your thoughts to that email account, so we've got them all and can have a record of them. And we have a record of them here too. So thanks so much.
All right, we have Fran up next.
Hello, just to introduce myself, I'm Francis Janik. I am a registered patient, or have been since 2011. I was also an advocate and an activist for the medical program, and I am currently interested in seeing this program progress. I'm simply going to second every single thing that Jessie Lynn just said, and I welcome you including us in the discussions going forward to advance this program. I have seen this program, and this is just a brief comment, focused on the corporations since the beginning, on the profit of those corporations, on the investors of those corporations, many of whom have made decisions and continue to make decisions that affect all the patients in the state that have been underserved, especially those who cannot afford expensive cannabis therapy products that are not therapeutic because they are simply have not been pure over the time that we've dealt with this program. So I welcome all of the advances and changes. I think there's a lot more that needs to happen, and thank you very much for hearing my comments today.
Thank you, Fran.
Okay, we have Keith.
Hello, everybody. How are you today?
Good, thanks.
I am a medical patient. My name is Keith Rowe. I'm located here in Southern Vermont. I also recommend the things that I stand behind Jessie Lynn and Fran Janik. They've been advocates for a long time, as myself. I highly recommend the Americans for Safe Access model, the legislative model they have. I've sent this directly to all members of the CCB as of today. The Americans for Safe Access is one of the largest medical marijuana groups with over 100,000 patients for the medical advocacy of safe access to cannabis in the United States. I highly recommend you look at their legislative model, and I have contacts with the American Safe Access as a member that I am currently standing and have been. They have some wonderful stuff on their website that you guys can follow to add to this. I also highly recommend using the Maine medical marijuana model that is currently in existence, that has some really good things into it that allow for patients to be protected, because Vermont's current medical program has zero protections for medical patients, has zero ability to use in a hospital, a nursing home, a school, or any other type of nursing facility, and we're calling this a medical program, you cannot use it anywhere. And it needs to be changed to the fact that cannabis does not only include consumption by inhaling it nowadays, it consumes by being able to drink it, take an edible, a transdermal patch, or a dropper, or a tincture, or an ointment that somebody could use in a hospital. We have these chronic conditions that are listed on our medical program, such as HIV and AIDS, and we are denying those patients, if they're in a hospital, medical cannabis because we have nothing in place in the state of Vermont for them to use it. So if they go in there and they're on medical cannabis, they don't have it. I also highly recommend that we need to find some information of drug interactions with the regular prescription pharmaceutical companies that are prescribing drugs to patients, especially the elderly group and other patient pediatric patients, that have the cannabis interactions of cannabinoids, flavonoids, terpenoids, and terpenes all interact with pharmaceutical drugs. That would be great research. I highly recommend Dr. Dustin Sulak out of Maine, which is DO, and he is on the International Cannabis Science Board. He is also runs his own healthcare facility called Integrated Health, and he has served over 20,000 patients between Massachusetts and Maine. And he also has his own website called healer.com. You can find that. He has ongoing live education all the time. I also recommend for another website to use the stakeholders for Green Flower Media. They have great information there, and I have other further information. I also recommend a dosing chart that interacts with dosages for edibles, because edibles are very tricky with a lot of people depending on weight, size, and dosage that you're getting. And that's something that during the stakeholder meeting that should be brought up. I highly recommend those two things. And I advocate, and hopefully I could be a part of the member of the stakeholder group as well, because I advocate, and I'm a patient here and have been for some time. I also fall under the chronic pain thing, and I feel disadvantaged because my chronic pain is never going to go away. And it just isn't. So I have to continually pay the $50 fee. I do have one quick question that could be clarified. When the changes go in for the 6 and 12 plants, as an adult and over the age of 21, this might be for the executive director, Brunner, am I able to continually cultivate my home grow and my medical to increase my plant count? Because there's no provision saying I can't in the state of Vermont under statute or regulation saying I cannot do both. That I can grow my home grow of my 2 and my 4 and my 6 and my 12 now. That is, there's no regulations there saying that you cannot do that. There needs to be some clarification. Is that allowed? So it increases plant counts for patients in the state of Vermont. Thank you.
Okay, you ready, Keith? So under the home grow statute, households are entitled to that home grow allowance. And under the patient and caregiver registry statutes, registered patients are allowed their allowance as medical patients. There's no prohibition that would limit you to one or the other.
Thank you.
Yep.
L. Cragen. Just first initial L and then Cragen. I apologize if I'm getting the last name wrong.
I'm going to unmute this person just in case they are trying to talk and we can't hear them. Maybe I can't do that.
I don't think we can unmute someone.
I'm
as a
sorry,
third
that was
party.
me.
There we go.
I muted myself in case the dog barked when you were going through the meeting. I just didn't see that. Sorry. My name is Loretta Cragen, and I was on the Symptom Relief Oversight Committee. My question is about who picks the patients that are going to be on this new study committee? What's the criteria for picking the patients? So is the stakeholder group the same as the study group that's going to be meeting? And if you could tell us how to apply, patients how to apply for these positions and how they're going to be designated. Thank you.
Sure. Yes, thank you for your question. So there's the statute, if you look at the bill, there's no specific language about how, about appointments that are going to be made or who is responsible for appointing specific patients or caregivers. And so it's the board's proposal that anybody who's interested in participating in this committee, send an email to the email address that Melissa mentioned earlier. We'll say it again here in just a moment. Indicating your interest in taking part in these meetings. As I mentioned at the outset, these are going to be public meetings because the board is involved. So all of the meetings will be public, and we are specifically required to engage with medical patients and caregivers, registry patients and caregivers, and also the licensed medical cannabis dispensaries and also medical professional stakeholders. So it's very important that people from all of these groups are participating in these meetings. And to provide one more point of clarification, I know I did mention, I refer to this group as a study committee and a stakeholder group. It really is the same thing. If you have access to the internet and you can look up H270, you'll see it in section 21. It's a short piece of language that tasks the board with working with the stakeholder group to develop these recommendations and report back to the legislature in January with recommendations about that specific set of sort of items to review, including assessment of those conditions that are most appropriately treated with cannabis, strains of cannabis recommended for treatment, dosing, and appropriate treatment protocols. And also how the use of cannabis is communicated to patients and patients' providers, and then any other issues that will improve the program. So send an email. Melissa will repeat that email address for me.
It's ccb.med, MED, at vermont.gov. And if you could make the subject line stakeholder group recommendations, then we can compile them all together.
Yes. And because these meetings will be public, we will be posting them on the website and providing notification for when they'll be held. And we will provide specific outreach to people who have indicated that they would like to participate in these group meetings.
Thank you. Is there a number, is there a number of patients that since I didn't read the section 21, is there a number?
There's not a specific number. No.
Okay.
It just says registry patients and caregivers. So we can have, there's not a limit to the number of registry patients and caregivers that can participate.
Okay, thank you.
I see Keith has his hand raised again. We do have one other person who's raised their hand that has not had an opportunity to ask the question yet. So I'm going to move on to them. We have Rev Baker.
Hey there, can you hear me okay?
Yes.
Yes.
Awesome. First, I wanted to thank you for doing these meetings. This is great, very helpful. As somebody who is in both the medical space and also working in the adult use market, it's really great to know what's going on both sides. So thank you for your time on that. I wanted to second a point that Jesse Lynn and a few other people had made that I encourage the board to advocate for further clarification of the chronic pain condition. I know this is a statute issue and it's not the board's decision, but I hope that the board will advocate for that because, as Jesse Lynn and others pointed out, chronic genetic conditions are different than broken limbs. So I think there should be, it seems unnecessarily discriminatory the way it's currently phrased. So that's that point. And then I had a question from a friend who wanted to remain anonymous just because of the implications of even asking the question, whether or not participation in the Vermont Cannabis Medical Program precludes someone from purchasing or owning a firearm in the state of Vermont. There's been a lot of national news about this. So I wondered if there is, if that is the case here, and if so, if the medical program can make a better effort to put that information out there when somebody signs up for the program, if that is the case. And I'll pass along your answer to my friend. Thanks.
Yes, I have a memory that we have a frequently asked question about this specific issue on our website. And that your friend is correct that there are federal prohibitions on firearm ownership if you are involved in a medical cannabis program. And I think that that information is available on our website. I will confirm that and email it to you if you are able to leave your email in the chat, if that's something you're willing to do.
All right, Keith, do you have another question?
Yeah, it's directed at Bren. My question is, in H270, was the oversight committee dissolved due to the H270 bill? Because now we're going to have a stakeholder and a working group, and there will be no oversight committee. Was that dissolved when
So
H270 passes?
No, the H270 didn't do anything with the medical cannabis for symptom relief oversight committee. That committee was in statute that was repealed in 2021, I believe, when the new medical statutes were created in the original bill. So I believe that the medical cannabis or the symptom relief oversight committee dissolved a year ago or over a year ago at this point. 3/1/22. Okay. Yeah, so it was a statutorily created committee. And when the new set of statutes was created for the medical cannabis program that transferred the oversight of the program to the Cannabis Control Board, that provision of statute was not recreated. So essentially that committee was repealed at the same time that the Cannabis Control Board was created. That's how, hope that's clear.
Fran has another question.
Yes. Go ahead,
Hi,
Fran.
actually, I just wanted to offer a little clarification on the firearms issue. Although the cannabis is still Schedule 1, and therefore that question is still on a firearms form when someone does go to try and purchase a firearm. There was a federal judge who made a ruling against that, basically stating that he did not find that cannabis was a problem, that people became dangerous. So that's in question at this time, even in the federal government and the law. So there's a little bit of a murky cloud over that. I just wanted to make sure you guys knew about it. Thank you.
Thanks, Fran. So just as a follow-up to that piece, it sounds like that our frequently asked question may not be on our website with respect to the firearms, probably exactly for that reason, that it's a little bit murky at this time. But we will do our best to update our website with those frequently asked questions and provide some more clarity about the firearms issue.
So we don't have anyone else with their hand raised. We do have one person who is not Kimberly joined via phone. So I'll turn to phones for a moment to give those folks a chance to ask questions. You can hit *6 to unmute yourself if you have a question. And if you do not, no pressure, but I'll just give folks on the phone an opportunity to ask questions if they have them. All right. Seeing none, you can turn back to Teams. And again, you can raise your virtual hand to ask questions. There is not at this moment anybody with their hand raised.
Okay. Well, it's 10:57, so unless somebody raises their hand, I'm just going to make a few final remarks, is just to remind everybody that the board will be meeting over the summer and the fall with this group of stakeholders to discuss the medical program. And it's the board's hope that they have a lot of participation from the medical community to make sure that everybody's voices are heard in getting some recommendations to the legislature for how to improve the medical program. And there have been a whole number of ideas that are totally appropriate for the legislature to consider in making some changes to the qualifying conditions, for example, or other significant structural changes that the board can't make through rulemaking. So please send us an email to ccb.med@vermont.gov and indicate that you are interested in hearing about when those meetings are going to be held, and we will provide direct notification to you when those meetings are scheduled. So I want to thank everybody for their time today and for their thoughtful comments. It's always helpful to hear from the medical community, and we look forward to hearing more soon as we embark on our stakeholder group meetings. So I'm going to close it if there's no other comments. Thanks so much, everybody.
Thank you for having us.
Bye.